हो गया शायद.
Yes, yes, you can start now.
Okay, I can.
Yes, yes, you can.
Good afternoon, everyone. So today I'm going to speak about diabetes in general. The topic for today is know your ABCs of diabetes. So as you all know that diabetes is slowly becoming a grappling disease with the many comorbidities and many life-threatening complications. So it is important for us and for the general population to know in general about diabetes. What are the signs and symptoms? What should we get checked? When should we get checked for diabetes? And also, what are the complications of diabetes and how we can prevent it? So, what are the ABCs of diabetes? So, A stands for HbA1c levels. So, what is HbA1c? So, HbA1c is a simple test which is done in all the diabetic patients every 3 monthly or say 4 monthly. So it basically detects your blood glucose levels in the past 3 to 4 months. So it gives a broader range of idea and it gives a detailed picture of your glucose control in the last 3 to 4 months. So it is a very important test to see whether your sugars, your 24-hour sugars are getting controlled or not. So it is to be done every 3 monthly or 4 monthly. The target levels should be below 7%. So when the HbA1c levels are below 7%, we say that the diabetes is in control. Above 10% are very serious levels of very high levels of sugars. So always, even during the first visit of the patient, even when the patient comes to you, say after 1 or 2 years with a irregular follow-up, the first thing which you should be doing is HbA1c. So this is the A of diabetes, that is HbA1c. Why should we do HbA1c? Because it gives a better idea than the fasting and the postprandial glucose levels which the patient usually comes to you with. The HbA1c levels give you a broader idea of which class of anti-diabetic drugs should be chose to halt the progression of the diabetes. मराठीमध्ये सांगायचं झालं तर HbA1c लेवल्स हा एक तपास असतो जो आपण दर 3 महिन्यांनी आपल्या डॉक्टरकडे जाऊन केला पाहिजे. डॉक्टर तुम्हाला सांगतच असतील. तो केल्याशिवाय आपला डायबिटीज हा गेल्या 3 महिन्याच्या ॲव्हरेजची शुगर जी असते 24 तासातली ती कधी कळत नाही. त्यामुळे हा तपास 3 ते 4 महिन्यांनी, दर 3 ते 4 महिन्यांनी हा डायबिटीज पेशंटनी करणे गरजेचे आहे. So the second thing is B. So B stands for the blood pressure. As we all know that diabetes and blood pressure goes hand in hand. Each diabetic patient should get their BP checked during each of their consultations. The target blood pressure should be, the systolic should be less than 130 millimeters of mercury, and the diastolic blood pressure should be less than 80 millimeters of mercury. So usually in our clinical practice we see that almost 80 to 85% of the patients who are diabetic are also hypertensives. So it should not go unchecked. Your BP should be monitored during each of your consultations. Also, in some cases, uh, from doctor's point of view, we should not go with a single reading, because most of the times when patient comes to a clinic or hospital, he is anxious regarding his blood glucose levels. He's anxious regarding the considering the hospital environment. So most of the time we get high readings. The diastolic is usually 80 to 90, but the systolic may be 160, 170. So we should not go by a single reading, because then if we start the patient on any antihypertensive drug based on just a single reading, it may cause more damage than good to the patient. So it is always good, it is always better to recheck the blood pressure, say after half an hour, by asking the patient to sit in the clinic itself, or by asking him to visit your hospital or clinic at a different on a different time after say 3 to 4 days. Or another option is you can ask the patient to undergo ambulatory blood glucose monitoring. So it is called ABPM, which gives you a very nice and better idea about the blood pressure readings of the patient throughout the 24 hours, even when he is doing his daily activities at home. So in these cases, whatever I just told you, that is the false readings of higher systolic blood pressure, which we usually call as white coat hypertension, gets ruled out. So ABPM should be done in patients who have many fluctuations in their blood pressure, and who are bound to have 160, 170 or 150 systolic every time during their consultations. So blood pressure monitoring is very necessary in diabetic patients. Uh, Blood pressure, if not controlled, again leads to many complications. The risk of cardiac mortalities, the risk of strokes increases if your blood pressure is not in control. Even your kidneys can get damaged. Even the creatinine goes high if your blood pressure is not monitored. So blood pressure monitoring is important in diabetic population, because in diabetics already the kidneys and the eyes and other organs are getting affected. So if your blood pressure is not controlled, then it will cause more harm, and the management of or the prevention of the complication becomes more difficult if your blood pressure is not in control. Other home remedies which you can do to control your blood pressure is decrease your salt intake. So that we always advise our patients की दोन पांढरे पदार्थ, as we called, the sugar and salt. Avoid sugar and salt in your diet totally to get your sugars and blood pressure under control. So we Indian population have the habit of having pickles or say papad or any other salty snacks in our day-to-day life. So that must be avoided because they are high in salt intake, salt content. So basically, if you restrict your salt intake, it will also protect your kidneys in the long term, and your blood pressure will also remain within the normal range. So decrease your salt intake, cut down your junk food, avoid in between meal snacks, and just concentrate on your blood pressure. The third thing is cholesterol. So the C in the ABC of diabetes stands for cholesterol, which in scientific terms we call as lipid profile. So lipid profile is a test. It is a simple test which should be done at least, I would say, at least 6 monthly in a diabetic patient. It should be done on a fasting stomach. The fasting levels, the fasting blood is taken to measure the lipid profile. So three things we concentrate on in the lipid profile, and those are, that is total cholesterol levels, the serum triglyceride levels, and serum LDL levels. So your total cholesterol level should be less than 200, your serum triglyceride levels should be less than 150 or 160, and your serum LDL levels should ideally be less than 100 according to the newer guidelines. So LDL is called the bad cholesterol. It is bad because it mainly plays a significant role in the thrombus formation and the platelet aggregation, which eventually leads to increase in the number of myocardial infarctions, heart attack ज्याला आपण म्हणतो. So lipid LDL is a bad cholesterol. It should be always kept in check. It should be always kept under 100. In more high risk patients, there are certain criteria where we say that the patient is high risk or at a very high risk. In such patients, the LDL level should be less than 70, or in very high risk it should be less than 50. So so get your lipid profile checked every 3 months, I would say, or at least every 6 months. Indian population is known to have higher levels of triglycerides. So your triglycerides levels, even though your cholesterol and LDL levels may be normal, but your triglycerides are mostly high in diabetic populations. So each and every prescription of diabetes in patients above 45 years of age as a primary prevention should contain a statin. In secondary prevention, such as patients who have already had an episode of CVA, that is stroke, or an episode of myocardial infarction or any other cardiac event, they should be started on antiplatelets plus a statin, and their lipids should be measured every 5 to 6 months. So C stands for cholesterol. The home measures which you can do to keep your cholesterol levels in check is अवॉइड फ्राईड फूड. तेलकट पदार्थ आपण म्हणतो किंवा फ्राय केलेले पदार्थ आपण खाल्ले नाही पाहिजेत. अवॉइड ऑइल इन जनरल इन युअर फूड. ट्राय टू ईट as bland as possible, so your cholesterol levels will remain low. So all these three ABCs of diabetes should be followed in order to keep your diabetes in control, and most importantly to prevent complications. Why do we treat diabetes? Not just to bring down the sugar levels. We treat diabetes to avoid complications, the deadly complications of diabetes, which are diabetic nephropathy, diabetic retinopathy, stroke, and myocardial infarctions. These are the main complications which are life threatening and which can debilitate you if not kill you. सो मराठीत सांगायचं झालं तर हे ABC तुम्ही फॉलो केले पाहिजेत. वन्स अगेन आय विल टेल यू. A स्टँड्स फॉर HbA1c. तुमच्या HbA1c लेवल्स तुम्ही दर 3 महिन्यांनी तुमच्या डॉक्टरकडून चेक केल्या पाहिजेत. इट सिम्पल ब्लड टेस्ट आहे ती. B स्टँड्स फॉर ब्लड प्रेशर. तुमचं ब्लड प्रेशर तुमच्या प्रत्येक कन्सल्टेशनला तुम्ही चेक केलं पाहिजे. अँड C स्टँड्स फॉर कोलेस्ट्रॉल. सो लिपिड प्रोफाईल तुमचं दर 6 महिन्यांनी चेक झालं पाहिजे. In quick 1 or 2 minutes, I will just tell you that which diet or what diet should be followed in order to keep your sugar levels in control, and also your cholesterol and BP should be kept under control. So increase your fiber intake. That is first. Fiber intake, our Indian population or Indian diet lacks in fiber. Fiber content should be very high in your foods. Second, avoid carbohydrates, the bad carbohydrates. Diabetics should totally cut down on carbohydrates such as potato, bread, maida. All these things should be avoided because these are simple carbohydrates. What we should consume is complex carbohydrates such as sweet potatoes, and there are many other carbohydrates. And increase your protein intake. Those who are vegetarians should focus on this because their diet lacks in protein. Our protein should at least I am saying it should be 0.8 gram per kilogram per our body weight. So if your body weight is say 60, at least you should consume 40 to 45 grams of protein per day. All the non-vegetarian sources have high content of protein, and the vegetarian sources for protein are cheese, paneer, मराठीमध्ये आपण उसळी म्हणतो, कडधान्य, milk, and if some vegetarians are able to have eggs, then eggs, the boiled egg, the whole boiled egg along with the yolk contains almost 6 grams of protein, and without the yolk contains 3 grams of protein. So high fiber intake, high protein intake, and less carbohydrates. If at all you want to use carbohydrates, you can focus on consuming complex carbohydrates. So you can Google it and see which complex carbohydrates are available, which you can include in your food. Avoid oily foods. Be active. Avoid sedentary lifestyle. Cut down on your cigarette smoking. I should say completely stop your smoking. Cut down on your alcohol intake. Regular exercise, at least 45 minutes, 30 to 45 minutes per day, or at least 150 minutes per week. Concentrate on weightlifting. Give time for meditation and yoga, and get a good sleep. So this diet and lifestyle changes along with your medicines and along with your regular checkups will help you keep your diabetes in control and prevent the complications. I hope this video was useful, and any comments or any questions are welcome. We have one question here. I have suffered from Om Prakash Yadav. I have suffered from high blood pressure, high blood sugar for several years. Do you think it damaged my nerves? Yes, the answer is yes, because diabetic neuropathy is one of the complications of high sugars. And if you are having sensations such as tingling and numbness, म्हणजे बधिरपणा किंवा पायाची आग होणे किंवा हातापायाला मुंग्या येणे, असं काही होत असेल, then definitely अगर आपको हाथ में जलन हो रहा है, मुंगी आ रहा है या पैर में जलन हो रहा है, then definitely you must have damaged your nerves. So get it checked by your consultant and start the medications. Another question from Mr. Shailesh Prajapati, that is, how does stress affect blood sugars? It is proven that stress affects your blood sugars. Cannot explain in this video why and how, but yes, a calm mind and a stronger mind definitely helps to control your blood sugar levels. If you are constantly anxious and overthinking, and if you are constantly stressed about something, definitely it will affect your sugar levels, and it will be difficult for you to control your sugars just by medicines. So there is one more question asking about what are complex carbohydrates. As I told you that there are two forms of carbohydrates, simple and complex. The complex are the good carbohydrates because they have low glycemic index. These things you have to Google because I cannot explain it here. Low glycemic index basically cuts down your sugar levels. So most of the complex carbohydrates are like oats. Then there are sweet potatoes. There are other many carbohydrates. There are some form of bananas which have complex carbohydrates. So you can replace your normal diet by such things. You can avoid rice. You can cut down your rice, and then replace all these simple carbohydrates by complex carbohydrates. Okay, so I guess that's it. Thank you. Hello.
सर तुम्हाला स्टॉप करावं लागेल तिकडे.
हो हो हो, yes yes.